Joining me now is Arkansas Republican Governor Asa Hutchinson. Arkansas is a state that has expanded Medicaid. Governor, thank you very much for joining us. You weren't a big fan of the House version of this bill. How do you feel about the Senate's?
Well, there's a consensus we have to change from the status quo, both in terms of Medicaid, but also in terms of access under Obamacare. The Senate's doing the right thing by pursuing this initiative and trying to get a consensus. At my suggestion and other governors, they have changed a number of portions of it in the revised bill that I think gives more flexibility. Well, specifically, they gave us a block grant on the expanded Medicaid portion, which we asked for, and I applaud my United States senators for achieving that success. We asked for increased subsidy for those low income that's on the exchange right now so that they would have improved access. That was granted to us. And then they've also given a more fair distribution between the states. So they've made dramatic changes in the revised bill. I quite frankly expect probably additional changes to be made before a final vote is taken.
What else would you need?
Well, the big thing is a fair distribution between the federal government and the state in terms of savings. We acknowledge in Arkansas that we've got to increase the level of savings. We want to partner with the federal government to do this, to make sure that Medicaid is available for our most vulnerable and who it's designed for. Also to be used, secondly, to help bridge that gap as people move from Medicaid onto the workforce and have more assistance in getting affordable health care coverage. That's our objective, so you really have to work on that balance and struggle between the federal participation and what is being shifted to the states. We can save money, they're just asking too much at the present time, and that needs to be adjusted.
So you have 300,000 people in Arkansas that have health care from the Medicaid expansion. Are you confident that these block grants, these increased subsidies, are going to help or ensure that those folks are still covered if this Senate bill passes?
Well, I'm convinced, first of all, that the administration wants to have coverage for those. The design is that they are able to shift to the subsidies on what is now the exchange, but it'll be a refundable tax credit. So the goal is that they're covered, it's just in a different means. Again, we're worried about the transition. We're worried about the flexibility given to the states, and you mentioned 300 and some thousand in Arkansas that's on the expanded Medicaid. That's too many. And so we want to be able to move more of those over to the exchange now. Hope to get a waiver for that accomplishment. And so we're looking at work requirements. We're looking at controlling those numbers better, so we acknowledge that it's not really sustainable for a long time. Are you saying that those people that are on the Medicaid expansion right now aren't working? No, we're saying that some of them aren't working. We want to put a work requirement in. I think it's about 60% that are working, but some of it's not a matter of just working, it's about training. Do they have the job skills to get the job and move up the economic ladder? We want to be able to provide that training. So it's the assistance. We don't want to make Medicaid a permanent entitlement in terms of that expanded population. We want to make it a stepping stone to higher worker performance and higher pay. So your two senators in Arkansas don't have a public stance on this bill yet. Do you believe that they should? Well, I just appreciate the way they're working with us. They're the reason that we got these three adjustments in the bill that I mentioned. We want to continue working with them, hopefully pushing the leadership of the Senate to have a better cost split and share with the states. I expect change to be made. Let's see how it develops. But I appreciate how they've worked with me as governor. Are they going to vote yes? Well, I don't know that they even know what the final product is, so I'll let them speak to that. And people want governors and others to take a final position on it. My job is to articulate the impact that it would have on Arkansas. Right now, it's a cost shift that is difficult for us. It needs to be adjusted from that. We'll continue to look at it and hopefully get more numbers. We want to look at the stability that is being advocated by the administration that gives us significant flexibility to the states. but we're not sure that it covers everything yet.
So if nothing changes from where it stands now, would you advise your senators to vote yes or no on this bill?
That's a call that they make. They're elected to make that vote.
What would you like them to make? Your personal opinion, as the steward of the state of Arkansas, what do you want to see for your people with the bill as it stands right now?
I'm answering your question. As the bill stands right now, it's too great of a cost shift to the states. That needs to be adjusted. We'll work with them to create savings in terms of the federal government, because we need to have savings. Give us the flexibility, we can do it, but right now it is too great of a cost shift that I'm looking at.
Governor Asa Hutchinson of Arkansas. Sir, thank you very much for joining us.
Thank you.